What's up, everybody? This is Dr. Bartu with another episode of Pilltalkpodcast, giving you a daily dose of medicine to keep you inspired, motivated, and live at your full potential. Today, I have a special guest, a clinical pharmacist, a residency trained, Giae Derisse, coming at you today. So please, everybody, welcome her in. How you doing today?
I am doing wonderful. How are you?
I'm all right. I appreciate you taking the time out your busy schedule to come be on Pill Talk Podcast to, give some people some motivation and inspiration.
I'm excited. Let's do this.
Let's get it. So I want to start off and ask, what got you interested in being in the pharmacy field? Like, what sparked your interest to get into it?
Right. That's a good question. I'm not one of those people that were like, I knew I wanted to be in healthcare since when I was younger. I feel like when I was younger, I wanted to be everything. And then kind of just as I got older and I was thinking about my strengths in school and what I want my life to look like in the future, I geared more towards healthcare. So then, of course, in healthcare, there's like tons of different, healthcare professionals, right, that all work together. So I kind of heard about pharmacy before. And then I was like, knew about medicine, but I knew I didn't want to be a physician. So I majored in exercise science and sports studies actually in undergrad. And we were taking a physiology course and they were talking about how drugs affect the body. And that was just so interesting to me. I was like, how does that work? How does a drug go to a receptor and have this effect? And I just became more and more interested. So then after that, at that time, the only kind of setting that I knew that pharmacists work were the traditional retail pharmacy setting. So I walked into the pharmacy and I essentially just asked for a job. And fortunately, they gave it to me. It was a small community pharmacy and I worked there for quite some time. And I really just enjoyed how the pharmacist was the bridge between all the healthcare professionals. We were kind of that final step to make sure everything was going according to plan. And I just really enjoyed the respect that the pharmacists had and how they cared for their patients. And I was like, you know what, maybe I'll go for this. And then so slowly I did what I needed to do, took the test, applied, and here we are.
Here we are. Let's back up a little bit because I think a lot of people got their start in the pharmacy field working retail, right? But your retail was actually a little different than most because you had a community. When you said a mom and pop's type of pharmacy, right?
Yeah, it was a mom and pop. It was owned by a husband and wife that met in pharmacy school, and they've been running it for years now. So it wasn't your traditional big chain store. It was that small community feel, which I enjoyed.
Definitely. So I got my start initially working for a big chain, but then later on in pharmacy school, I was able to do a rotation with a small mom and pop type of pharmacy. Nice. And the experience working at big chain and working at a mom and pop is totally different. They view things totally different.
Yep, exactly.
Since you was in that experience, if you don't mind, can you talk a little bit about the community setting?
Yeah, definitely. So in the traditional community setting, you have patients who are prescribed something and then they come to the pharmacy to pick up that medication. Depending on the type of pharmacy, there could be different services. So there could just be your traditional dispensing medications. You could also counsel patients if they have questions. I think one of the things I really enjoyed, what always stood out to me, that there was families, literally from great grandma to the baby that came to the same pharmacy. Yeah. And so they would pick up medications for each other if it was allowed. And it was just so nice to be oh, hey, how's, the newborn doing? And it was just really nice to form that community. And people really enjoyed coming back. They always commended us for what we were able to do in the community. And I feel once you're entrenched in the community, then you give back in terms of volunteer events, hosting tables in the community. So that's always really nice to kind of just look beyond your job, but look to see how you can build the community that you serve.
Yes, definitely. And when I actually was doing my rotation at the mom and pop's type of retail pharmacy, that is one thing that stood out to me too, was the fact that the owner of the place or the pharmacist that was there, he did not just know everyone by their name, but he knew their family member's name. He knew their dog's name. Like, he was a part of everybody's family that came in there. So that was really like inspiring. Like, had me thinking about trying to open up my own small independent pharmacy, but we'll see about that in the future. But yeah, that was definitely an experience.
Yeah.
So that sparked you and led you on to becoming a pharmacist and going to school. And I just mentioned earlier that you have a residency. So are you able to run down the education that it takes to become a pharmacist? And then after we get through the basics, let's talk a little bit about the residency program that you were in.
Okay. Yeah, that sounds good to me. So in terms of the basics for the education needed to become a pharmacist, so there's a few different ways. So there's some schools that have a 0 to 6 program. So as soon as you graduate from high school, after 6 years, you go through the schooling and you're a pharmacist. Some people take a more traditional route, which is doing the 4 years of undergrad or just getting the prerequisites and then going off to pharmacy school for 4 years. That's what I happened to do. I went to Rutgers University for undergrad and then Rutgers Pharmacy School afterwards. So essentially, you just have to make sure that you have the prerequisites. You apply to pharmacy school, and most pharmacy schools are 4 years. There's some accelerated programs that are 3 years. And then once you graduate with a doctor of pharmacy degree. And then after that is kind of when you decide which path you're going to take. And there's many different paths, but residency is one of those paths, and that's the one I chose.
Nice. So out of all those options, what made you decide to do the 4 and 4 type of deal? Or did you just ended up doing something in undergrad that you wanted to keep pursuing before you got into pharmacy school?
Yeah, that's a good question. I think, I'll be honest, in the beginning of undergrad, I was very, I would say, like, confused on what I wanted to do. I wasn't really sure. And I hadn't really thought about pharmacy heavily enough to want to apply straight from high school, because I do feel like that's a big decision when you're 18 years old to already choose your career. So I was kind of like, lost, kind of finding my footing in undergrad. And then once I decided, about like halfway through undergrads, and that's when I was like, all right, well, I could, finish the prerequisites in 3 years and then apply to pharmacy school. But I was like, why not just get a bachelor's degree and then also have a doctorate degree? So that's what I ended up doing. So I took a little bit of the long route, 8 years total, but, it was definitely worth it in the end. I feel like I matured a lot in undergrad, and that allowed me to do well when I got to pharmacy school.
Yeah, same thing here. Same thing. I even changed my majors in undergrad. So it was like, major was chemistry. And then I was like, yo, okay, this is getting a little difficult. Let me switch it up. Let me do the major of biology with a minor in chemistry. And I was like, all right, this fits a little better.
A little more doable.
Yeah, but I do feel like undergrad helped prepare me as an individual going into pharmacy school. So those 4 years in undergrad, I was able to experience life as a young adult on my own. And then when I got into pharmacy school, it was just like, okay, I got all the kicks and giggles, the fun out, time to like focus in and just do what I have to do at this point, because now it's about the career and not just networking and making more friends. But
Exactly. And I feel like at that age, when you make that conscious decision, you're just so much more focused, and you're like, I made this decision. And I think you're also more conscious about like the financial aspect of it as well. So you're like, I'm going to maximize these 3 or 4 years. So I just think it benefited me to do undergrad. Some people may mature faster than me and they're able to, jump on the gun straight from high school. But I think everybody's story is different. But it doesn't, discredit the fact that at the end you all graduate with a PharmD.
Yeah, definitely. So one of the things that they pushed while we was in pharmacy school when I was there was, after you graduate, look into a residency. I actually looked into one, applied to a couple, whatever. But you are here and you have went through a residency program. So can you talk to us a little bit about what made you decide to get into the residency program? And then what were some of the things that you learned within it?
Right. That's a good question. So, kind of when you start thinking more about like what you're going to do is that fourth year pharmacy school, when you're going through all those rotations and you're getting exposed to different types of pharmacy fields and pharmacy practice. I went to Rutgers University, so they have a lot of fellowship programs. So that was something on my mind. And then there was also, of course, the residency, because there's a lot of clinical, pharmacists and clinical specialists that works for my school as well. So when I kind of thought about, my goals long term, increasing patient care, I was like, I think residency is the route for me. And then I, obviously thought about it very logistically and calculated. And I was like, I feel like it's always good to have, for me at least, that residency foundation. And then from there, if I decide later on down the line that I want to pivot, then I'm able to. But I didn't think I'd be able to do the reverse, especially if I got used to, making like a full-time pharmacist salary or something. Going backwards would be pretty tough. Yeah. So my last year of pharmacy school, I decided, I know a lot of people, like, they decide they're going to be a resident, like their first year of pharmacy school. I didn't know until like my third rotation, my last year of pharmacy school. And that's when I really decided and got the ball rolling. So I went through the whole application process, interview process, match process, and was blessed enough to get residency. And the things I learned in there were a lot. You learn a lot. I think residency is like two parts. You learn a lot clinically and about pharmacy, but then you learn a lot personally about yourself and, the things that you can endure and all those kind of things. So I just did a general PGY1 residency. So what that means essentially is that it's a broad year. So you get exposed to different patient areas. So you might go in doctor's offices and be the pharmacist there. You might be in a cardiac unit, a pediatric unit. You might be teaching. You might be with the manager, director of pharmacy, doing management things. So there's different types of aspects you're exposed to so that when you leave, you're able to have a good foundation in any of those things. Personally, I decided to only do a PGY1, but there is an option to further your training and do a PGY2 in a specialty area.
Nice. So I want to back up a little bit and talk about the matching process, because I don't think I had someone on yet. And we talked about just the matching portion of getting into a residency. Because I don't want everyone to know, like, getting into a residency isn't just like applying to your undergrad. Like, you're not just going to apply and just get into it. So because you have this experience, can you talk a little bit about the matching program for the pharmacy residency, please?
Absolutely. It is definitely not like any kind of regular application at all. So essentially what happens is you, based on personal preferences, let's say you're limited to a certain state, a certain area, or you want to do a certain specialty that's only in this hospital, perhaps, you kind of make a list of all the places that you've researched online. You go to their information sessions, maybe you go visit them on site in person, and based off of that, you apply. So you do a formal application through this portal. And it's just, basic information. You put your CV, which is really important, which describes all the things you've done throughout your pharmacy journey and beyond.
Hold on, before we get past that, let's make sure people know what a CV is. Because,
okay. Of course. So a CV stands for curriculum vitae. I think it's Latin. I don't know if I pronounced it right, but hopefully you guys get the gist. So essentially, a curriculum vitae outlines all of your history and all the hard work you've done. So usually it'll have different sections. So those sections can include education. That's where you would put your pharmacy school. It would include any kind of training. It would include, the clubs you were in pharmacy school, if you were involved in any clinical competitions, if you were the president of a club, if you volunteered, if you won any scholarships. So essentially, details your life professionally, all the things that you've done. Some people may be familiar with the term resume. It is a little different in that the CV is more detailed. It is a little longer, just to give the employer or potential residency program more of a background of who you are and what you can potentially bring to the table. So that's why it's really important in pharmacy school and even outside of pharmacy school to really get involved. So by the time that time comes, if you want to apply for a residency or fellowship or even any job, that you are setting yourself up for success by getting those opportunities.
Nice. That was a really great explanation. And I can remember being in pharmacy school, and one of the things that they made sure that we were on top of was our CV. Mm-hmm. And I felt like every semester, every couple of months, they was like, are you guys updating it? Are you putting everything into it? Because they was like, don't wait to the end of the year to try to update and get your CV corrected, because you will forget most of the things that you've done.
Yeah. Because you do a lot in pharmacy school. You do so much and you don't even realize it. And then by the time it's time to apply for a job or whatever, you're like, oh man, it looks like I've done nothing, but you've done so much. So that's why I'm glad your school emphasized that, because it's really important, that professional aspect. Because at the end of the day, like, we're not going to pharmacy school to not get a job. Like, we want a job. So you want to make sure that you're setting yourself up, especially against, whoever else may be applying.
Definitely.
Yeah.
All right. So back to the speak about the residency. So you got your CV, you're applying in, and you're trying to get matched. So what's that process from there?
Right. So after you send your application, then the program, if they, like your application and you fit well with their program, they rank you on their list and they'll send you an interview invite. So they'll extend the interview. You're going to accept, of course, unless you totally are like, I do not want this program anymore. Then you accept the interview. You go to the interview, wherever that may be, at the hospital, most likely, or at the clinic, wherever you're applying, and you interview. All these people interview. Each program interviews a different amount of people, depending on how much their cohort is, which means like how many residents they have. So some programs only have one resident, and some programs have up to like 30 or 40 residents, right? So then after the interview process, then there's two sides. So you as an individual, there's the ambulance. I don't know if you can hear it.
Oh yeah, it's fine though.
Okay. So after that process, after you interview, then there is two sides. So you have me, the individual, the applicant that's applying. And based on how you felt about each program, what you think how you can benefit, the program, how you like it, then you rank them. So, you say my top choice is this hospital. My second choice is this hospital. And you go down all the interviews that you got. Then the programs themselves, they have their own rank list where they'll rank each candidate that they interviewed. So at the top would be like their highest rank. They want to make sure they get this resident, and they go down from there. Then there's this process called the match. So it's this like computer algorithm thing that I don't really understand. But essentially, they say that it favors the applicant. So what it does, it says, okay, this applicant's top hospital, let's call let's say there's like Disney Hospital. I don't know if that's a thing, but let's say there's like Disney Hospital, right? So then there's that's their number one. Then Disney Hospital ranked them number one. So that's a match, right? But let's say that hospital ranked them number two, but since that's their number one, they would match. But if someone else behind them came, it's like kind of confusing, but essentially they rank you based on the level that you rank them and they ranked you. And of course, there's a limited amount of spots. So let's say they interviewed 20 people, but there's only 3 spots. Then based on that algorithm that tries to match the candidates, then there'll only be 3. Yeah. So it kind of goes down the list. It'll go to your first choice first, and your second choice, and your third choice. And then based on that, you either match or you don't. Unfortunately, there aren't enough residency programs to support the number of applicants that do apply for pharmacy residencies. So sometimes and oftentimes, pharmacy students don't match. But there's different processes afterwards. There's like a second phase of matching, and then another phase, and then a scramble. So there are different opportunities, but unfortunately, it isn't a big enough pool at the moment for all the pharmacy residencies to apply. So it's definitely a hard process. It starts like in November, December, and March is usually match day. So it is definitely a long process.
Yeah, I remember that. Yeah. By you going through the details, I'm like, oh yeah.
I know. It's like painful to think about. It's really stressful, but I'm happy I did it in the end.
Yeah. I can remember everyone sitting there looking at the computer in March, like, is it going to happen?
Oh yeah, that email. You're waiting for that email to come through. Like, did I match or did I not? It's definitely a little nerve-wracking for sure.
All right. So you got matched into your residency program. And then you did a general PGY1, which you touch bases on a lot of different fields that pharmacy practice in.
Right.
Within that, did you find one that you really enjoyed the most?
Yeah, I feel like I've always had an affinity for like cardiology and the heart and like anticoagulation. I just really love that. It's just so fascinating to me. I feel like cardiology is like the perfect structure function. It's just like so interesting. We need our heart to supply all the needs for the rest of our body. So I've always loved cardio. And I've also loved other aspects of, pharmacy and medicine, like critical care. I really enjoy like kind of like things are very quick, things happen quickly, patients' status changes quickly. So I enjoy that too. So I feel like those were like my top two aspects that I liked. Some other aspects that I liked that I didn't previously get exposure to was pharmacy management. So essentially that means like the leadership in your hospital. So like the director of pharmacy, pharmacy operations, different managers, and kind of how they manage the pharmacy, how they connect to the larger leadership within the hospital, the CEO, and all that kind of stuff. So I really enjoyed that too. So those were all great experiences. And I really enjoyed like every single one of my experiences, but if I had to rank them, that would be the top three.
Nice. So, all right. You just graduated from your residency. Congrats to you on that.
Thank
Big
you.
ups. No problem. So, which one of those are you currently working in now? Or are you still kind of like bouncing around to feel out which one you want to settle into?
Right. So for me, when I was in residency, in the beginning, you really want to decide if you're going to specialize, which is go to a PGY2 or after PGY1, have gainful employment. I decided not to do a PGY2. I really as much as I loved cardio and I loved critical care and I loved management, I really wanted to be a jack of all trades, if that makes sense. I wanted to kind of know about everything, and I didn't want to limit myself so much, especially in the beginning. So I decided to go after PGY1 and seek a job. So right now I am a clinical pharmacist too at a hospital, and it is more general. So I do get exposed to many different things. So there's critical care, you have cardio, you have general medicine, and there's opportunities, of course, for projects and things like that. So I was, definitely blessed and fortunate to get this position where I can kind of go to different aspects, kind of feel things out. And if in the future, if I want to kind of hone in more, then maybe I would ask, to be on that certain floor more. But for now, I really enjoy the work that I do.
Nice. That's great. That leads me into the next question, because when you enjoy the work you do, you can make a great impact on your patients' lives. Mm-hmm. So if you are able to, can you give us an example of how you made an impact or how you touch one of your patients in a positive way, and describe that for us, please?
Of course. So one of the responsibilities I have in my current position is to counsel patients on their medications as well as their disease states. So when I say counsel, that basically means to teach them a little bit about it, show them how to use the medications, kind of tell them ways to, improve their disease state and things like that. So of course, one of the big ones is diabetes. So I actually had a patient not too long ago who came into the hospital. Their A1C was through the roof. Their sugars were consistently high. So I kind of looked into them a little more, dug a little deeper, kind of saw the insulin that they were on before. And I saw that they hadn't gotten it filled in 6 months. So I'm all right, I have to go counsel this patient. We have to see what's going on. And so I went into the room. I'm introducing myself and everything. And I'm oh, so you have this disease state called diabetes. are you kind of like familiar with like what is this disease state? Kind of like asking open-ended questions to see how much they know. And it kind of turns out, a few months ago, he found out he was diabetic, and he was just prescribed insulin, and he was just sent on his merry way. So he didn't really understand like the consequences of that disease state. So I went through like kind of the high points of how it works. And I also went through, unfortunately, not to sugarcoat anything, the harmful effects diabetes can have. You can lose your vision, your kidneys, get amputated. And, that kind of really made an impact on him. He's like, I didn't really know this. And so after we started talking about medications, and he's like, oh, I had refills, but I didn't really go to pick them up. Like, I didn't know it was like this serious, Mm. And so after we talked about the medications, we talked about lifestyle management, of course, like diet and exercise. And at the end, he was just like so happy and so grateful, because he's like, he was relatively young. He's like, I want to live a long life. I want to be able to, have kids and, have grandkids and see those things. But I didn't know that something like this could prevent me from doing those things. So he was really happy and really grateful. And he was like setting goals and all this stuff. And that made me really happy, because I could tell that, he was ready to make a change, and the fact that he really understood. And I think that's one of the reasons why I do love pharmacy, because we are that bridge that can really take the time with the patients to counsel them on their medications, review their lists, make sure nothing's interacting, and give them the confidence that they need to manage their disease states on their own. So that was something that really kind of had an impact on me, because I think sometimes, as, educated healthcare professionals, we can think that people already know what they're taking and about their disease state, but sometimes patients don't. So it's definitely like an eye opener. And I think that was one of the ones that stood out to me.
Nice. Man, that was a great example, because it's so many times that people come to the pharmacy and they're on a medication and they don't know why. Mm-hmm. They don't even know what's going on with them. They just know that the doctor said, hey, take this medicine, it'll make you feel better. And then immediately after feeling better, they stop. So you have to have those conversations, those consultations, where one, breaking down a disease state and letting them know what exactly is going on with them. And then two, giving them understanding of the medication so that they feel empowered, because now they know what the medication is, what it's used for. And now they're knowledgeable about it. And then that right there leads them to be better at adherence with the medication.
Exactly. And that's what's important, because medication adherence is going to be one of the key driving factors to help them manage their disease states. And it's like, when people know why they're taking the medication that they take, they're going to continue to take it, so that's a good point.
Definitely. And I'm happy. This just reminded me of like why I got into pharmacy. Was because as a kid, I would ask my mom, my grandmama, and I'm like, hey, what's the medication for? And they had no idea. They're like, my doctor told me to take it. Mm-hmm. And I was like, I had to figure out like why. Like, why are you taking this? Like, I wanted to understand the medication, like understanding what was going on. Mm-hmm. And just that whole example, like this guy didn't even know that. I guess he knew he had diabetes, but didn't know and didn't do anything about it. Like someone needed to be that bridge to him. And I'm happy that you was able to step in there and be like, listen, I don't know what happened prior to me, but let me educate you from this point forward so that you don't get rehospitalized or to come back to the doctor with these type of symptoms and illnesses, whatever.
Exactly. No one wants to be in the hospital, and we don't want to see them there, especially when they can be managed. So I think that's why the role of the pharmacist is so important, both like in the hospital and as well as outside the hospital.
Yes. I'm glad this wasn't one of those examples where someone knew what was wrong with them and still didn't do it.
Yeah, those are tough. I think with those, you really kind of have to like get to the root cause. You have to find out like what motivates them. And I've been learning too on like how to motivate patients to, help them adhere, because it can be really hard. People go through a lot of things. So those are the more tough scenarios.
Yeah. Like, I had a situation where, this happens all the time, but being in a retail pharmacy, when someone would come in and they're getting their medication for gout. And I'm like, hey, do you know your gout triggers? They were like, yeah, I know. But I had to have the crab legs. I had to have the bear. I'm like, but you limping in the building. They're like, I know. I'm in pain. I need the medicine now, but I had to have it.
I mean, how can you say no to crab legs?
When you're from Maryland, how can you say no to crab legs? But if you get the gout after eating them, you might need to leave the crab legs alone. Leave it alone.
I know. That's tough.
Yeah, that's funny. So, you've done a lot so far, but getting through pharmacy school, getting through residency, and if people don't know, being a resident is like being in school and working a full-time job all at the same time. So how was you able to find a work-life balance, definitely with everything going on around now, like the COVID and all this other stuff that was happening?
Yeah, it was definitely tough. I'll be honest. I'm originally from Jersey. I don't think I mentioned that. And I moved down to the DMV area just for residency. And like you said, they say 1 year of residency training is 3 years of practice, right? So you have to fit those 3 years into 1 year. So it can definitely be tough. I'll be honest again and say like my work-life balance wasn't the best during that year. It is more work, I think, in that season than life. But I think, it is just a season. It's just that. It's just a year. It's just 2 years. And then you have the rest of your life to reap the benefits of the hard work you put in. So I think some of the things that I tried to do was exercise. I would try to get at least like 30 minutes, at least like a few times a week. That was really important to me. Go on walks, take days off, use my PTO that you earn and just, hang out with family, chill, sleep. But there are a lot of times where it is going to be a lot of work. So I'm not going to sugarcoat that part of it. But I think, you can always think to the future that like one day, you don't have to come home and work on like 3 different PowerPoints simultaneously. Yeah. You can, relax. So it definitely is hard to find that work-life balance. And I think it looks different for everyone in residency, kind of depending on where you are in life, whether you have a family or you're single or you're living at home or not. So it's different things like that.
Yeah. I think what you did was some good stuff. Like exercise definitely could relieve stress. Mm-hmm. You also got to have a point in time where you just have to like turn off everything, like just rest, relax, and then come back to it with a fresh mind, because you can't just be all work the whole time.
Right. Yeah. Right. You'll definitely burn out quicker than you should.
Definitely. So, I think my last question for you tonight is, what's your career goals moving forward? So like you stepped into your career fully now, 5 years from now, 10 years from now, where do you see yourself going towards?
That's a good question. I feel like I have so many goals and things I want to do in life. Sometimes I have to like slow down and stop myself. I have always really loved public health, health outcomes, education. So I'm hoping, in that 5 to 10 year mark, I'm able to expand upon that, whether that's, educating in a pharmacy school or in other healthcare professional school like nursing or PA or something like that. I really do enjoy public health. So for me, that means reducing healthcare disparities, increasing healthcare access. So that's getting pharmacists in places that healthcare isn't accessible. That's medical missions to me. That's what that means to me. So hopefully within, the long-term goal that is a part of my future. So those are kind of like the main things that I'm focusing on, and just, getting better at my job and, learning as much as I can to benefit my patients and the hospital that I work for.
Nice. Great, man. I feel like this conversation with you brought me all the way back. And this is a conversation like I believe a lot of people need to listen to and hear, just for the breakdown of like getting into pharmacy school. What is the actual CV, the match program, how that actually works, a little bit about the residency. So like you gave out a lot of information just on that so that people can understand what they could look forward to in the pharmacy program. And some of the things that we've talked about, like the CV, the match, could be applied to different medical fields as well. So if you're going to be a doctor, dentist, or whatever, they're not the exact same, but they're very similar, and they could be used on different things. So
exactly.
If there's anything else you want to talk about or say to the people.
I would just say, I think that something important is to always do good work and do good work consistently. I think that that'll take you far in terms of, your own work ethic and how you show up for the things that you need to do, as well as for those around you, right? So if you, eventually want to advance, you want to show that you can do work and do it well consistently. So that's really important. And then, of course, keep going regardless of the doubt that you have or the worry or the anxiety that may come up. Myself, I'm sure you as well have had a lot of doubts throughout, your journey, whether that's in pharmacy or not, but sometimes you just have to keep going and the outcome will be there. So you don't want to let, those kind of anxieties hold you back. So those are my little words of wisdom.
Dope. Nice. Some powerful words right there. I think I'm going to have to take a couple of those for some captions, but don't tell nobody.
You better tag me, okay?
Hey, I got you. Caption credit. So if anybody wants to get in contact with you, if they got some questions, they want to know about pharmacy from you, want to just, be inspired by your story, can you give them your Instagram handles, anything like that, so that they could get more acquainted with you?
Absolutely. So I started an Instagram last year, 2020, I think it was, where I documented, my pharmacy journey and kind of post pharmacy. So that's at gdpharmd on Instagram, gdpharmd.com. And if you want to email me, it's gdpharmd@gmail.com. So you can find me on any of those outlets.
Nice. So Giae, thank you for coming on Pill Talk Podcast, giving us the daily dose of inspiration to live at our full potential. Man, I appreciate you for taking the time out. I know you got a busy schedule, so this means a lot. Thank you for that. The audience appreciates you.
Thank you. This was fun. I appreciate it.
All right.